The next thing you need to understand in terms of your knowledge base is that there are reactions to crime that are also going to occur. Now, some of these reactions to traumatic bereavement or a trauma related to a crime, we call them PEBC, P-E-B-C, which almost sounds like Pepsi-Cola. We refer to them as physical, emotional, behavioral, and cognitive. The physical reactions to a serious violent crime can range from gastrointestinal problems, high blood pressure, hot and cold sensations, headaches, a feeling of being under a panic attack or what we call an anxiety attack, fatigue, exhaustion, a general feeling of malaise, melancholy. These physical reactions can also result in worsening health conditions that you already are having. If you've had bouts of arthritis or other kinds of diabetes or whatever, your emotions are so affected that it has a physical reaction in the person who had this violent crime, this attack, this sudden news that someone has been murdered or a DUI fatality has occurred, and it's such a sudden adrenaline shocking response to the system that a lot of physical things begin to happen. In fact, there's some research that indicates that a stress like this diverts your body's immune system from normal fighting of infections or cancers, which it would normally do, and therefore it's diverted so that the body has infections and they gather strength, whereas without this particular crime reaction and stress reaction, your body might have normally fought that disease or that cancer. The emotional reactions are feelings of anger, depression, guilt, feelings that you're emotionally drained and unable to deal with this particular reaction. It can be numbness, disconnection, hopelessness, despair, survivor guilt, self-doubt. Various fears come to your mind. You're worried about being safe. You have a sort of a general feeling of anxiety or panic, or feeling that you're not as safe as you used to be. These feeling levels are very normal, as I indicated. The behavioral changes that can come from these feelings are sleep problems, nightmares, jumpiness. You can be easily startled, hypervigilant. You can have crying and tearfulness, avoidance of reminders, increased family conflicts, isolation, social withdrawal. These behavioral reactions to the emotional aspects of a crime are quite normal. The cognitive reactions can be confusion, disorientation, intrusive thoughts, images, recurring dreams, nightmares, memory and concentration difficulties, difficulty making decisions, focusing on protecting loved ones, and questioning spiritual beliefs. The reason these reactions are so important to understand is that some people might actually be diagnosed as having a serious disorder called post-traumatic stress disorder, or PTSD, or ASD, acute stress disorder. These reactions need to be clinically diagnosed to meet this test of whether this disorder is occurring. But you can also have symptoms related to PTSD or ASD, but you just don't have the full-blown diagnosis of the disorder. If you do have these kind of hypervigilant or hyperarousal or trigger moments where it flashes you back to the original crime and you feel a panic or sense of panic, anxiety attack, these kinds of things are important to both understand and to be treated and to be referred to psychiatrists, psychologists, clinical social workers, and other clinicians who are trained at diagnosing PTSD and ASD. And the most recommended form of treatment is individual and group treatment. And the most recommended form of a treatment for a person who's had a homicide, DUI fatality, or a serious violent crime where it was a trauma is some form of support group, where it's a mutual self-help support group in addition to individual treatment by a clinician. Now you, as a spiritual leader, can sometimes be the person that gets that individual crime victim to go get this diagnosis, go get this evaluation to see if a full-blown PTSD or ASD is present. You can do something as a spiritual leader yourself, which is very important. You can go to www.psychtests.com and you can ask them to take some basic tests. There's a depression test, an anxiety test, a coping skills inventory test, and bring those tests to you. And then you, as a spiritual leader, can say and read the results of the test together with the person. And I know you're not a psychologist, but if you see that there are basic problems resulting from those test results, you can make an important recommendation that they go see a licensed clinical person who's trained to diagnose PTSD or ASD. The other important determination you can make is if you see them constantly being sick and having chronic infections or not looking well, you can ask them to go see their medical doctor. It could be important that they get prescribed medication that helps them deal with this particular kind of reaction they're having to the trauma of the crime or the trauma bereavement from the loss of a loved one to a murder or a DUI fatality. There's a lot of feedback that we're getting in our support group that Prozac and Zoloft and those kind of antidepressant drugs are helpful in dealing with the initial phases of a serious violent crime like a murder or DUI fatality. And there are a number of other antidepressants, and those may be selected that are appropriate for that particular crime victim and the way in which their body responds. I hope by now I've given you an overview of some things that will help you with a knowledge base. You now have an understanding of the basic crime victim rights. You now have an understanding of stages of grief. You now have a better understanding of how crime victims react to serious violent crime occurring in their life. And I want to move now into something I call resources. You can be a very important resource deliverer and referral mechanism for if you're a spiritual leader who comes into contact with a serious violent crime victimized person. What you can do is you can, in the state of Georgia, you can access two very important resources quickly. The 211 database that United Way has is immediately accessible by dialing 211. It's also available online. And all the list of organizations that are available through their 211 helpline are immediately accessible to you as their spiritual leader. For example, say a person comes in and says, you know, I'm having a tremendous amount of trouble sleeping. I can't sleep at all, and I feel a sense of anxiety and panic attacks. I don't understand. I'm disoriented. I can't work. I feel dysfunctional after this loss of a loved one to a murder. At that point in time, you could say, well, where do you live geographically? We can find maybe a homicide co-victim support group in your area. You could call 211, the United Way helpline, and locate one for them and give